Hello and thank you for tuning into my channel. I'm Dr. Carmen McGuinness. Today I'm going to talk about the symptoms and treatment of attachment disorders in children and adults. Attachment refers to how we bond with and connect to loved ones. The first bond is, of course, to the parent during infancy and childhood. This bond is dramatically affected by how our parents bonded to their own parents. So we can see how the good, the bad, and the ugly can be passed down from generation to generation. In addition to what's in the parents' repertoire, learned from their own childhood, let's discuss some other possible contributors to a less than perfect attachment. Parental illness is certainly one, including mental illness and depression. Child illness could contribute, especially when it's chronic, such as in asthma. Having a developmental disability, such as autism or Down syndrome, can inhibit the natural bonding process, making it harder for children to read the cues from their parents and keeping the parent in a worried state. Addictions of all sorts, drugs, alcohol, and yes, even gaming, keep parents from doing their parenting thing. Separation or divorce can certainly contribute, with parents being distracted, saddened. Financial troubles and unemployment can contribute to attachment issues. Overemployment can also create challenges, parents who are working all of the time. Time between births, 2 years seems to be a magic number under which the parent may find it difficult to deal with two small children so close in age. And of course, life's little distractions, such as that ringing phone or that incoming text. So some signs and symptoms of attachment issues in infants and small children might include avoidance of eye contact, not smiling, doesn't reach out to be picked up or is overly clingy, rejects his parents' efforts to calm, soothe, and connect, or clings but doesn't calm down, doesn't seem to notice or care when parents leave him alone, or becomes hysterical when there's signs of separation from the parent, cries inconsolably, doesn't coo or make appropriate sounds, doesn't follow the parent with his eyes, or follows the parent around and won't tolerate any separation, isn't interested in playing interactive games or playing with toys, spends a lot of time rocking or comforting himself in some other way, has night terrors, or has imaginary friends. In slightly older children, an aversion to touch and physical affection could be an indicator. Children with attachment disorders may react very differently to other children when they're touched. They may laugh, flinch, or act as if it hurts when someone touches them. A need for control. Most children with attachment disorder go to great lengths to remain in control of all situations and avoid feeling helpless. They can be non-compliant, defiant, and argumentative in their efforts. Anger problems. Anger might be demonstrated aggressively in tantrums or passively by acting out or by manipulating others. Even behaviors that seem as socially acceptable may covertly be aggressive, such as overly tight hugs or high fives that actually hurt. Difficulty showing genuine affection. Children with attachment disorder may show affection to complete strangers. Just walk up to people in stores and say hi and even hug them. Or they may display little or no affection toward their parents, and then suddenly show great affection on another day. An underdeveloped conscience is consistent with attachment issues. Children with attachment disorder may behave as if they have no remorse and fail to show appropriate regret after their bad behavior. Ambivalence. Children with attachment disorder may appear not to care when punished or may appear to be disinterested when presented with reinforcers for good behavior. In adulthood, if left untreated, the avoidant dismissive attachment style in adults, which is one of the more common two that we see, in this case, people who formed an avoidant attachment in childhood tend to have a dismissive attachment style in their adult romantic relationships. They learned early to disconnect from their physical and emotional needs and may avoid emotional intimacy with their partners as adults. Dismissively attached adults will often seek out relationships and enjoy spending time with their partner, but they may become uncomfortable when the relationship gets too close. They may perceive their partner as clingy or needy when she or he expresses a desire for more intimacy. Dismissing adults tend to use preemptive strategies to deactivate the natural attachment process. Some researchers believe this is based on an actual fear of rejection, such as the rejection that they perceived that they had in childhood. So, for example, they may choose to get involved with partners who don't want a close relationship, and or maybe they get involved with someone who seems to want a close relationship, but then they select only to notice events and conversations which support the more casual end of the relationship. They tend to report very few memories of their childhood, relationships with parents, and they may even describe their childhood as happy and their parents as loving. But when they're pressed, they're often unable to give specific examples to support their positive appraisal of their childhood. People with this type of attachment tend to be focused on themselves and their own comfort, sometimes disregarding the feelings or desires of others. They also find it difficult to disclose their own feelings to partners. Their response to disagreement and conflict is often emotional distance and to become aloof. They may have an overly positive view of themselves and tend to look down on others. However, their apparent high opinion of themselves is often fragile, protecting a vulnerable interior. In the narcissistic end of this spectrum, the inflated self-image compensates for self-esteem problems and often self-hatred. The insecure avoidant attachment style is another attachment style that stems from poor attachment during childhood. People who formed a fearful attachment style in childhood often mature to be insecurely attached in their romantic relationships. Although they crave emotional closeness, they lack the skills to maintain truly intimate relationships. They are often drawn to partners who avoid emotional closeness, so the ones we just talked about, the dismissive ones, just as their parents did with them when they were young. They tend to do most of the emotional work in their relationships, sometimes creating a sort of fantasy affair in their minds, when in reality, the relationship is less than ideal. They might drive away their partners by appearing possessive and demanding, or suddenly snap out of the fantasy and end the relationship themselves. When outside of a relationship, the insecurely avoidant individual often rallies in their independence for a while, only to become involved with a new partner and repeat the same pattern. Insecure avoidant types tend to be people pleasers and problem solvers and are sometimes taken advantage of for this by their friends, co-workers, and employers. They may be drawn to the helping professions such as education or medicine. So there are professional interventions for attachment disorders that have been found to be quite effective. For children, there are 4 in particular. Attachment and biobehavioral catch-up is one. This intervention focuses on teaching parents to recognize that their children need nurturing, even if their behavior seems to suggest that they don't. It helps parents to develop mature behavior of their own and learn how to nurture their children and to provide a responsive and predictable environment for the child to improve regulatory capabilities. In other words, it helps these parents learn how to co-regulate their children so that the children learn how to regulate themselves. Another is child-parent psychotherapy. This intervention is for children who have experienced some kind of trauma, typically. It works on strengthening the parent-child relationship to protect the mental health of the child. And another is parent-child interaction therapy. This program was designed for children experiencing behavioral and emotional problems, what we call EBD children. It teaches parenting skills and helps strengthen the child-parent relationship. And then the fourth is Circle of Security, which has been very, very highly rated. This intervention teaches parents the basics of attachment theory, so it's actually a classroom format, which helps parents to observe interaction with their child and understand how to respond to their children's needs in a sensitive manner. And then the approach that's used by many therapists, myself included, is a more eclectic approach. Many therapists and counselors apply this approach to working with attachment difficulties. However, the focus is always on parenting skills, child behavior, and improved parent-child relationship. So, parenting a child with an attachment problem, some tips for you. Set limits and boundaries. Children need consistent boundaries to feel they are safe and that the world is predictable. It's important that children understand what's expected of them and what is unacceptable. A clear understanding of what the consequences will be if those unacceptable behaviors do occur is very important to natural, normal development. When consequences are clear, children learn that they have control over what happens to them and that it's not just a punisher coming from outside for no reason. We suggest that parents take calm control when their child is upset or misbehaving. Bad behavior is a sign that your child doesn't know how to handle what he's feeling and needs your help to interpret and regulate his emotions. By staying calm, you show him that the feeling is manageable and that all feelings are manageable. Following through with clear consequences in a matter-of-fact manner reinforces the idea that the world, his world, is predictable. Being available to reconnect following conflict is also critically important. Conflict can be especially disturbing for children with attachment disorders. Be ready to reconnect after a conflict as soon as your child is calm. This lets him know that you're consistent and that you love him and that you're there for him. Try to maintain predictable family routines and schedules. Believe me, I know from my own family that this is hard in today's world. Children with an attachment disorder rely heavily on routine. If something will be out of order or off schedule, which of course it will, it's best to warn the child ahead of time. Talk about what's going to happen and reassure him that you'll get through it together. Find things that make your child happy. If he tolerates it, show love by cuddling and holding him. But always be respectful of what feels comfortable and good to your own child. If it doesn't feel good, then don't do it. Other children may tolerate tickling and swinging if cuddling and rocking are not preferable. So just swinging on a swing set or a hammock. Hammocks are wonderful because they hold the child closely. Respond to the child's emotional age and at their emotional age. Children with attachment disorders may behave like very young children or infants. In this case, parents may need to treat them like the age at which they behave. Parents might need to use nonverbal means of comforting their children or controlling them when need be. Help your child identify emotions and express his needs. Children with attachment disorder may not know what they're experiencing emotionally or how to ask for what they need. Try and reinforce the idea that feelings are allowed, that all feelings are acceptable. There are acceptable ways to show what's going on inside and how to show those. Avoid drive-by parenting. Again, I know this is really hard in today's world. It may be difficult to find time when needs arise during the course of the day, but it's very important to stop what you're doing, make eye contact when parenting your child, and ask for eye contact in return. Be sure to pause and connect during regular activities such as snack and transition and just school-to-home transitions. Listen, talk, and play with your child. Find time when you're able to give your child your complete and focused attention. This is different than just normal caregiving stuff. This is when you actually sit down and read with him or play with him, go for walks, that sort of thing. Parents should understand that their own attachment style may have been impaired during childhood, and they should consider seeking the support of a therapist in regard to their own needs as well. Treatment of adult attachment disorders has been found to be very successful with many individuals. Insecure attachment can be successfully treated in adulthood. The therapist provides a secure base from which the client explores his interior landscape. Negative self-talk is addressed and restated in a kinder, more realistic manner. With the therapist's coaching, the client rewrites his own personal narrative regarding his own childhood and his romantic attachments throughout his life. Attachment-focused therapy, acceptance and commitment therapy, voice therapy, and emotion-focused therapy have all been found to be effective in working with individuals and couples facing attachment challenges. And just as within teaching children, we often use an eclectic approach. I've used all of those therapies in combination in working with individuals who present with attachment difficulties. So I certainly hope this has been helpful, and as always, if you find that you need more support than these videos provide, reach out to myself or another therapist. My contact information is on my About tab below, and I hope the rest of your day is sunny and bright, and thank you so much for tuning in.